So what do we know about health and well-being of government employees? As you heard about, we do statistics. So RBH AGS is actually the aggregate of 17,000 people, and these are what people report. Government employees report this, and the comparison is how much more. And you'll notice a couple of things. Number one, use substances to self-medicate is 1.62 times higher with government employees. Now, I want you to understand, we work in many different states, and the states that legalize marijuana have the higher rates. So from that standpoint, that's skewed slightly. But I want you not to think about what's being used, but why are they using it? One of the things I learned about in working in compulsive disorders was why is more important than what. So why do I drink? Why do I use substances? And they use substances because they want to be, deal with anxiety. And then if you look later on, you're going to see medication for anxiety and medication for depression. Look at the trends of government employees. Now, I'm going to give you a real quick reason why that's it. You know, I run a large company around and whatever. I don't call myself stressed. And the reason why is because if I don't like you, I won't work with you. Very simple. If I don't like an employee, I can fire him. You enter into what's called trapped stress. How do I know this? My dad was mayor for 27 years. I know what this is like. Why did I start college at 16? Not that I'm bright. He needed to get reelected, and I needed to get out of town, okay? So at any rate, what I realized is there's a trapped stress, which means my stress, it never is finished. It's never done right. There's whatever the size of your community, that's how many people you work for. And trapped stress, people with trapped stress will develop dementia 9 to 19 years earlier than people outside of trapped stress. So you look at some of these trends and you're going, pretty interesting. Then you look at what impact does it have on your behaviors, and I think you're going to look at some things, and I want to go on this one called harmonizing behavior, because harmonizing behavior is finally people just gave up. Nothing's going to change. I don't care. And you'll notice I put a little tag in there on government executives. Not only are they employees, but government executives are getting to the point of, is it really going to make a difference? And so these are some of the things that we know about what's happening in government. Now, we calculated out, that's what you said. But what you say, people lie all the time. People take the test and say, well, what if I lied? And I said, we know you lie. That's what AI comes in, is it says, yeah, right, you know? If you say you're depressed, what's that mean? We need to know, where do you live? Do you live in New York? Do you live in Sydney? Do you live in California? You answer that differently. A female will answer that 1.3 times more likely yes than a male. Very different things that you have to calculate. So we calculated out and said, where are the real issues? And look at this. Government employees, 1.47. One is where we should be. So you look at it and you got depression, anxiety, and then the behavioral health combines some other things that are in there. Those are the highlights. Now, you're going to see something very interesting, and doing predictive analytics, and everybody, by the way, that goes through this gets this. What's the likelihood of you developing a disease? CWP means clinically weighted prevalence. And we calculate it out, and if you're in between the green and the yellow bar, you're at risk. If you're over yellow bar, then you're at a significant risk. If you're over the red bar and it's cardiac, we just say schedule your stent whenever it's convenient because you're going to need it. So basically this is what it's saying, is we've got all of these characteristics that are in the at-risk, and we have at a very high risk diabetes. This is government where they land now. But what do you guys do about it? The answer is 60 to 61% don't exercise. That's the number one thing to help you. So basically what you're seeing is a trend of saying, I'm more unhealthy, but I'm doing less about it. So now let's answer the question, how good are we at doing health and wellness programs? So if you start out, you're saying, I believe the two questions you should ask, will people participate, and has it got good outcomes? Whether you feel good about it or not may not be important. If you like the people or not, you won't like us. No, my team's nice. At any rate, 71% of the people have a responsive stress that's interfering in their life. 40% are burned out, and it costs you about $1,400 for a person who doesn't participate in well-being. If you offer it to them, 23% will sign up. Of those 23%, only 48 will participate, which means only 11% of the people, 1 out of 10, that you offer a health and wellness program will participate. And those, by the way, are the people who are already healthy. Those are the numbers. So when we look at our outcomes, we say we have to be better than 1 out of 10. That's a pretty low bar. So let's look at it and look at a couple of other things. Why don't they use it? We looked at it and we say, number one, employees don't understand what well-being's about. They tend to think, okay, I got my blood pressure checked and it was fine, I'm good. You find also that they're disengaged. They really don't care, and I don't believe that they don't care. I keynoted American Psychiatric Association on treatment failure. Definition of treatment failure in psychiatric medicine is you didn't follow the program I gave you. Mine was, we didn't know enough about you to give a program you would do. I don't know anybody that wants to be depressed, angry, overweight, overreact. It's just we didn't know enough about you to give you a program that will work for you. And so you look at it and they're not disengaged, and I think also they're misguided because they feel that it's not me, it's somebody else. And I believe employers tend to have a tendency to say, well, I offer EAP and programs like that, so I'm doing a good job. And of course, there's always the stigmatism when you're talking about mental health programs.